Welcome to A Scientist Walks Into a Bar. I'm your host, Amanda Thomas, and today we have a special Barstool chat interview with a scientist who knows an incredible amount about brains. I had the pleasure of chatting with Dr. Eseosa Ighodaro, who has an MD in neurology and a PhD in neuroscience. She's currently doing a residency at the Mayo Clinic in Minnesota. I asked her about how she decided to do both an MD and a PhD at the same time, about her interest in science communication to the public, and we also talked about her plans for the future. She and I are tentatively planning to have her speak at one of our Science on Tap online events sometime in the next year, so keep an eye out for that. I'll put links to her bio and social media info in the episode notes. A quick note that we had a little trouble with the internet connection, so the audio is a little choppy, but we made the best of it. With that, here we go. We are here today with Dr. Eseosa Ighodaro, who is an MD and a PhD, and she has an impressive resume, and I would like to have you introduce yourself. So welcome to the show, Dr. Ighodaro.
Thank you. Yes, my name is Dr. Eseosa Ighodaro. I'm currently a neurology resident at the Mayo Clinic in Rochester, Minnesota. I'm also a neuroscientist as well. I originally grew up in Louisville, Kentucky, born and raised in Kentucky, did my education at the University of Kentucky, my MD, PhD, and then I transitioned over to Mayo Clinic about a year ago. So I'm very excited, and I'm very thrilled to be able to talk about my work with everyone here on the show.
Can you describe what an MD PhD program is?
Oh, thank you. It is a program, it's an 8-year program. So in these MD PhD programs, there are dual degree programs where you get your MD, your medical degree, which allows you to practice medicine, and your PhD, which is a doctoral degree in a specific area of research where you can delve deeper and get a better understanding of the scientific method and then publish information and articles on that topic. So there's a handful of MD PhD programs across the country in the United States, and they're usually associated with a medical school. So I applied to numerous MD PhD programs across the country, and I chose to stay at the University of Kentucky. So it's an 8-year program. The first 2 years, I did my medical basic science work. So I was in class with other medical students, learning the basic medical foundation. And then in my third year, I broke to grad school, or I took graduate courses. I picked a thesis topic and a mentor, and I spent 4 years working on that project. Then after I defended my PhD dissertation, I went back to medical school, and then I graduated in 2019. And now I'm doing my residency training. A lot of years.
What are the benefits of doing the combined program? What are you allowed to do now that you wouldn't do if you had one or the other?
Mm-hmm. As a MD PhD, we are in a unique position to be able to translate basic science work into the medical practice. So my PhD training enabled me to understand the scientific method. How do protocols get designed or created? Why is it that we use this specific lab measurement to test for Alzheimer's disease versus a different lab measurement or different imaging modality? And where does that information come from? And so the PhD gave me that understanding and that training. And then the MD allows me to be able to see patients and to be able to, talk to patients, order labs, diagnose, and treat. So those 2 degrees combined allow me to conduct research and then also allow me to practice medicine with patients. Because getting a PhD doesn't give me a license to treat patients. Getting an MD doesn't teach me how to do research. There are physicians that do research, but they have to take extra time and skills to be able to do the research that a PhD person can do. But they're 2 separate degrees, but they can tie in very nicely in translating research work into the medical practice.
And you are both a neurologist and a neuroscientist, right? Can you talk a little bit about what drew you to that area of the body? I'm interested in your past at this point.
So for the first question, the difference between a neurologist and a neuroscientist is a neuroscientist is a scientist that studies anything related to the brain, whether it's development, degeneration, and everything else in between. A neurologist is a medical doctor that sees patients that have neurological disorders that are not surgical interventions. Because sometimes in the field of practicing neurology, sometimes people think that I'm a neurosurgeon. And I'm not a surgeon. I don't cut people open. I don't do surgeries. Those are neurosurgeons. I'm a neurologist. So everything that is non-surgical, that's what I focus on, like seizures, dementia, stroke, etc. And then a neuroscientist is one who conducts research that can align with some of those areas in medicine. But a neuroscientist does not see patients by trade. So how did I get into being a neurologist and a neuroscientist? So I'll start from high school because that's where I always start when I tell my story.
Great.
I was always a phenomenal science student. I love science. If science was a person, I would marry science if I could. And so me and my second sister, we would, tag team. We would go to the science fairs and, showcase our projects. We always geeked out in science, and I would stay late, after classes. We would just sit and talk about different kinds of science experiments, just about, how can if I want to study this hypothesis, how would I design it? And so when I got to college, I just assumed that if you love science, you major in a scientific discipline. So I majored in biology, and I was able to, study genetics and cell biology and neuroscience. I just fell in love with it. It was one of my professors in chemistry who said to me that I always asked a lot of questions. So what I would do in class, I would sit there, and as he was lecturing, I would just sit and just daydream about all these different topics. And so I would just sit there and go to his office hours. We would just sit and talk about my long list of questions. And he said, "Your questions are phenomenal. Have you ever thought about grad school?" And I'm like, "Well, what is grad school?" So he taught me what grad school was. And then he encouraged me to start working with other scientists in different medical disciplines. So because of that, then I took off in different research labs. I, conducted research at the University of Kentucky in biochemistry. Then I went to Stanford for a summer, did research in developmental biology. Then I went to Europe and France and did research in neuroimmunology. And I just fell in love with research. And so then I came to a crossroad. I love research. I love medicine. What am I going to do? And then someone told me, "Hey, you don't have to decide. You can just do both." I was like, "Well, this is great. I'm just going to do both." So then I applied to MDPhD programs. And then University of Kentucky recruited me very well. So I decided to stay and, enroll in an MDPhD program. So now that takes us to medical school. Then the third question you asked is, how did I choose neuroscience? I chose it because it was the hardest class in medical school. It kicked my behind, but I just loved thinking about the brain. I would sit there again. I had my laundry list of questions. Why is it that a person who is legally blind thinks they can still see? There were just these conundrums that just blew my mind. How is it that someone can close their eyes and they can't feel anything, but when they open their eyes, they can feel? Or how is it that someone that has a stroke can see, they're not blind in either eye, but they completely neglect one half of their vision? They can't recognize their hand or their leg. How is any of this possible? So it was just these mysteries and these puzzles that I was fascinated with. And so because of that, I chose, my project in neuroscience, and then came back to med school and decided, what? I love neuroscience. I got a PhD in neuroscience. I'm going to be a neurologist. And so that's how it all tied in together. So that's the long story of my journey.
In your bio, it states that you were the first African-American female to complete the MD-PhD program at the University of Kentucky College of Medicine. And what are some of the things you wish people knew about not only being a female scientist, but also being an African-American scientist?
It is a very hard journey for someone like me. I surrounded myself with people who told me that I could do it, who believed in me, who encouraged me, and who never set limitations to my career. And it was those people that I fell back on when it got really difficult, when it got really hard, when I thought, I can't do this, I'm gonna quit. And it's because of them that I'm here right now. So for those that are interested in, doing this combined degree, know that you can do it, but know that it's extremely difficult, but surround yourself with people that will support you, be your cheerleaders, because we need more people in these fields.
I agree. I know that you're also interested in the role that racism plays in neurological health. And can you talk a little bit about what that means to you and how you hope to work in that area?
Yeah, so we in clinical medicine, clinical translational medicine, what that means is medicine research that uses population data to better understand how often a disease occurs in the population, and then what are the risk factors. So clinical translational medicine. When we use population data and we compare incidences of stroke in different communities, in the African-American community versus the Caucasian or white American community, there are differences. The African-American community has higher rates of stroke, hypertension, diabetes. And what gets published as a reason for that is genetics. And I think there's more to racial differences in diseases than genetics, because we live in a society where racism exists, unfortunately. So I study how does racism and the stress of being an oppressed minority affect our health to where it leads us to be more prone to stroke, high blood pressure, diabetes, obesity, etc. So that's where that's where I want to start trying to understand better in my work.
Yeah, we've had several people at previous events talk about things that are related to what you're discussing. We had a epidemiologist, Dr. Franklin from Multnomah County Health Department, which is our local county here, talking about poverty, racism, and public health, and talking about exactly what you're discussing, of how oppressed communities have different health outcomes because they're under so much more stress. And actually, our next event will be on July 16th. And it's on the neuroscience of racism.
Wow, that is so cool.
Yeah, it's a fascinating talk. I'll send you some more information about that. But we've done it a couple of times because we keep needing to have this conversation. He talks about the levels of cortisol in the body and how elevated levels of that and other chemicals can just really wreak havoc on your body long term, and how it's unfair and unrealistic to say it's genetics when African American communities have worse health outcomes. And I'd love to hear you talk more about that if you want to.
Yeah, and so I think, and the reason why for me it's so important is because when we focus on it as a genetic cause, the message gets sent that, well, it's in your genetics is permanent, then there's really nothing we can do. But when we change the way we interpret the data and say, wait a second, what about the stress? What about racism? What about the socio-political, economical factors that play into race that is causing, individuals of color to be at more stress, high cortisol levels, and high blood pressures? Because when we change it from genetics to the system, then we can say, well, if this is causing people of color to be sick, then we need to change the system so that people of color are not at high risk of dying from these deadly diseases. So I think that's the importance of really understanding the root cause of health disparities. And, not only applies to African Americans, you have the rural community, and as you mentioned, people of lower income, Native Americans, Hispanics, and other populations that are historically and currently oppressed for different reasons.
How does that factor into your long-term career goals? I read that you said that you're after your residency, you'd like to get a fellowship studying stroke or behavioral neurology. Does your interest in racism and the study of that, does that factor into long-term goals?
Oh, definitely. So after my neurology residency, which is 4 years, then you can either practice general neurology or you can subspecialize. And so there's many different subspecialties in neurology, and the two that I'm debating between right now is stroke and cognitive behavioral neurology. So stroke is, a term that's well known in the community. There's different kinds of stroke, and the most common kind of stroke is the one that's caused by a clot in your blood vessel, decreased blood flow to the brain, and then you have, weakness, the facial droop. That's, the typical stroke. But then you have cognitive neurology, which focuses on dementia, Alzheimer's disease, and memory loss in the aging population. So, in those two fields, what I would aim to do is, if I go the stroke route, better understand stroke in the African-American community from a prevention standpoint. How can I help the African-American community prevent stroke, given everything that we know about, stroke prevention, and then also add, the racism component. And if I decide to go down the behavioral cognitive neurology aspect, I would do the same, but in Alzheimer's or dementia.
What is something that you wish people knew about science in general?
That science is cool. I think, growing up, being a nerd was considered uncool. And, being someone who was a nerd and who still is a nerd and who loves science, I want people to know that it's cool and it's fun. And that for the young people out there, if you love science, go be a scientist. And there's many careers in science. And, science can transform how we study, how we practice, and how we live. And there's just so many different opportunities. So I think those are some of the things I want people to know. It's cool, it's fun, and it can be transformative, and it's important. And we need more scientists. I had one of my colleagues, I think this was at a conference or at a meeting, someone asked him about his job, and he said, I get paid to play all day. And he, meaning he's a neuropathologist, and what he gets to do is he has a lab, and he's, working with different stains and tissues to try and better understand, different diseases that affect dementia, at the molecular tissue level. And for him, it's like his playground. He enjoys it. I don't see being a scientist as a 9-to-5 job that I dread. I get paid to think, basically, is what I get to do. And it's just phenomenal that I get to do that. And me and my other colleagues, we get paid to think. We get paid to, try and solve problems that face human health. And it's just phenomenal. And it's exciting. I'm glad I get paid to do it.
My last question was going to be, what's your favorite thing about being a scientist? And you already sort of answered that, but.
Because, sometimes I stay up and I just have all these ideas, and you get to create what you want to work on and study. And, you pitch it, and if people think it's a great idea, then people will give you money to study that. Like, you get to create your own research projects, and the only limit is your mind and the resources that are available. And I just think that is just a very rewarding topic, because you get to choose what you want to do. And if you don't want to do it, you move on to something else that you like. Or if this doesn't work out, then you go on to something else. And so for me, because I like this constant challenge, I'm always challenging myself by doing new projects, trying to understand new things about, that my areas of interest. And so it's never boring, because it's always changing.
And I lied. That was not my last question. I have a couple more. So what's next for you? Did I see on Twitter that you saw your first patient as a resident?
I did.
Yeah.
I saw my first. So as a neurology resident, I spent my first year in internal medicine. And then now I get to start seeing patients that have neurological disorders. And yesterday was the first day I had my first neurology patient, and then, which is so exciting. And I'm just so excited about the next 3 years of my training, because now I get to focus on all things neurology, the brain, the CNS, and then the peripheral nervous system. And I'm just so excited to learn all these different diseases and how to treat people and how to understand, what's going on. And it's phenomenal. So for the next steps would be for me to hone my skills in neurology and really understand the practice of neurology, so that I can, better, treat people that come to my clinic and people that I see in the hospital setting.
And you are in Minnesota for the next 3 years?
Mm-hmm. For the next 3 years. And then if I decide to do fellowship, maybe at Minnesota, maybe elsewhere. But I'm very excited to just be able to, I've spent the last 20 plus years from kindergarten onward to be able to get to this point to, start studying and practicing the medicine that I want to practice. So I'm just very thrilled to be able to finally get to focus on the brain.
Well, I think your patients will be very lucky to have you caring for them. So,
thank you. Thank you.
So you have some social media things that you're working on. Can you tell us about how people can find out more about you and follow your progress?
Yes. So I recently created a social media account. I'm on Twitter, YouTube, Facebook. Those are my main Twitter account or main social media accounts. And the reason why I decided to start a social media is because I love teaching. I love teaching medical students, pre-med students, college students, anyone who wants to hear about the brain. I love teaching them about the brain. So that was the big reason why I started social media. And so what I started doing in that is I started trying to find creative ways to teach neuroscience and to make it engaging and fun. So I do image challenges on my social media pages. I've also started doing videos where I take a topic that people are interested in, know more about, and I, make a video on it. Back in April, I decided to send out a post about, hey, if you could ask a neurologist and or a neuroscientist any question, what would it be? And I got an overwhelming response to that post. I probably have got like 1,000 questions that I am going through and trying to categorize them into different topics. And some of the common topics were, migraines, dementia, what is consciousness, what are seizures? These were just very fascinating questions. So I'm taking these questions and I'm using them to help design what my next videos are going to be with an educational standpoint. And I'm putting videos out, as often as I can. And I also post things that are interesting to learn in neuroscience. So I'll post research papers, or post magazines, or just resources all related to the brain as well. And you can be found on any of these platforms. People who are also interested in becoming a neuroscientist and or neurologist. I've had several medical students, graduate students, college students, even high school students reach out to me, for my advice. And I'm happy to give them my advice. And I do all of this for free because I believe we need more people in these fields. And I want to educate people because I come into this field to help disseminate information to the public. That I work for the public. So all of it is free, and I'm, happy to help anyone that I can. Caveat is I don't give any medical advice on my social media. It's all for educational purposes. And I love teaching. And so if you're interested in learning more about, dementia, the brain, anything related to neuroscience, feel free to follow me on Facebook, on Twitter, and on YouTube. And send me your questions because I may just answer them on my social media pages.
Great. We will put links to all of those in the episode notes. So thank you, Dr. Ighodaro. I'm really pleased to have had a chance to talk to you, and I'm excited to see what you do next.
Thank you so much, Amanda. I really appreciate having me on.
Thanks for listening. We're working to provide lots of free science podcasts and online events, but we still have staff and other costs to pay. We know that a lot of people are struggling financially right now, but if you're able, we'd be grateful for any donations you would consider. We're working with a nonprofit partner called Make You Think, and there are 2 ways to donate. You can make a one-time donation of any amount, or you can join our Patreon with perks like pint glasses, stickers, and access to exclusive videos. I'll put links to all of that in the episode notes. Thanks to my crew who helped produce our events and our podcast, with a special thanks to Chelsea Schuyler for introducing me to Dr. Ighodaro in the first place. Thanks to Graham Tully for sound production, especially with this wonky recording, and to Jonathan Coulton for the use of his song Mandelbrot Set for our theme music.
One badass fucking fractal, and you're just in time to save the day.